Hello. Hello. Good afternoon, family. Good afternoon. Good afternoon, everyone. Just getting my phone set up there. Thank you for joining today. Good afternoon. Good afternoon. I'm excited to be back this week. Good afternoon. Thank you for joining. As you come into the live room, please just chat or wave to me your name in the chat box. I love to just make sure I can welcome you personally. So thank you for being here on Facebook Live today. Hey, day one, how are you? Good to see you today. Thank you. Thank you. As you come on today, please like and share. We're going to be talking about hypertension today. So if this is a topic that might be important to some people you know, some loved ones, please like and share so that they can be part of this conversation as well. And welcome, welcome. Thank you so much for joining today. We're going to get started in just a couple of minutes. I have some important information I want to share with you guys because there have been some changes in recent years as it relates to high blood pressure. So I wanted us to have a chance to talk about some of those changes. So again, as you come on, please like and share, and then we will go ahead and get started. Happy Sunday, everyone. Happy Sunday. Okay. I have a buzz there. Okay. All right. Awesome. Awesome. Thank you. As you come on, please like and share, and please type your name in the chat, wave to me so that I know that you're here and I can welcome you personally. Thank you again for being here. I appreciate y'all being here. Okay, I see a couple of other people have come into the room. Thank you guys. Thank you. Welcome to Sunday Live with Dr. Madeline. Today we're going to be talking about hypertension. So if you know of anyone who might benefit from this information, hey, Will, thank you for being here. Love you, bro. Thank you. Okay, so we're going to get started. This is a topic that's really important. Sometimes people think that it's not something that's important as part of the work that we do when we take care of our patients as OBGYNs. But high blood pressure and hypertension are absolutely things that we help with our patients in terms of their overall care. And just like with most things, most parts of medicine, is the first thing that we check when you come into our office. When you're waiting to be seen by any provider, your blood pressure is going to be checked. So today, I wanted to talk about high blood pressure because I find that a lot of people, it's something that a lot of people struggle with, but also it's something that in recent years, the numbers have changed. And I wanted to make sure that all of you were aware of the changes as it relates to measuring high blood pressure and what's considered normal and what's considered slightly elevated. So let me go ahead and introduce myself. My name is Dr. Madeline, your board certified OBGYN, international speaker and published author. I work with women, whether they are busy inside of the home or outside of the home, to make sure they have the most accurate GYN information they can get, as well as access to birth control so that they can have the most freedom and control over their lives. Please, by all means, follow me on Facebook, Twitter, and Instagram. And actually, I have a YouTube channel now. So please go to YouTube, search under Dr. Madeline, MD, and subscribe to my channel, please. I'm going to be doing some other live interviews, and I would love to have you guys join me there on my YouTube channel. So again, www.youtube.com, search Dr. Madeline, MD, and please subscribe to my channel. Thank you. Thank you. So let's get started talking about high blood pressure. Sorry, that's a notification on my phone. So let's get started talking about high blood pressure. So 3 things we're going to talk about today. One is what is high blood pressure? So we're going to talk some about that definition. The second thing is what are the newest numbers for normal range? And the third thing we're going to talk about is some things that we can do to lower our blood pressure. Okay, so what is high blood pressure? So, when you go into any provider's office or even the emergency room, one of the things they do is they check your blood pressure. So what exactly are they measuring? So high blood pressure, so what they're measuring is what's going on in terms of pressure in your vessels. And what happens is the top number we call systolic, And that number is the higher of the two. It measures the pressure in the arteries when the heart is beating. Okay. The diastolic is the bottom number in your blood pressure, and that is the lower of the two, and it measures the pressure in the arteries between heartbeats. So, so why is this important? When your heart is pumping and it's trying to pump through all these vessels in your body, the better your blood pressure is, the more effectively that pump your heart is at working, is at getting everything that is needed to your organs in your body. When your blood pressure is too high, it becomes more challenging for your organs to get what they need in terms of oxygenated blood. So high blood pressure is a condition that makes your heart work harder than normal. And if untreated, high blood pressure can damage several end organs. So you might know either in yourself or some family members, some loved ones, if they have high blood pressure that's been untreated for a long time, they can have damage to certain organs. It can lead to heart damage, kidney damage, their their visual situation can change if their blood pressure is untreated for too long. Kidney failure, strokes, which means that blood is not getting adequately to the brain. So that could lead to stroke. And really high blood pressure is, we call it the silent killer. And it's called that because you can have all these things going on in your body for a very long time without even being aware that they're happening. So that's why high blood pressure is called the silent killer. One of the symptoms that people might sometimes have when it comes to high blood pressure, and you guys might be familiar with this one, by the time someone comes in and they're complaining of a headache, a severe headache, that's usually a sign that their blood pressure has been up for some times. And usually those patients, we have to treat them acutely. We have to get that blood pressure down acutely, because a headache can sometimes be a sign that they could be in danger of having a stroke or having a cerebrovascular event, something going on in their cranium. Okay, so we always treat a headache as an important sign that something might be going wrong. So, what are the new numbers? And this is important, as I wanted to make sure you guys knew that these numbers came out and they were changed just a few years ago. So, if you guys remember, the number that we always used to talk about was 140/90. Right? I don't know if you guys remember that, but for many years, those were the numbers that we talked about in terms of what was the goal. What number do I need to be below to know that I'm probably doing okay in terms of my blood pressure? So a few years ago, different scientists and experts in the field got together and they said, well, we need to change that, because it looks like we're finding that a lot of our patients, by the time they are at 140/90, they are actually showing some signs of some of the organ damage that I talked about. So maybe some kidney damage or some difficulties with heart and other things that led them to make a decision basically to change the numbers in terms of high blood pressure. So what are those new numbers? Okay, so this is very important, y'all. The new numbers for blood pressure. So a completely normal blood pressure is one where the top number, the systolic, is less than 120, and the bottom number is less than 80. Okay, so that's the new cutoff in terms of what's normal. Elevated is now considered anything between 120 and 129 and less than 80. And then they go through these different stages. So again, you can see that what used to be kind of normal, it used to be normal to be in the 120 to 129 range, and now that's considered elevated. By the time you get to stage 1, which is a systolic of 130 to 139 over 80 to 89, we're already in the range of definitely needing to make some lifestyle adjustments and possibly even being started on medications. That's one thing that's important to keep in mind when it comes to high blood pressure. It's absolutely true that if you see a provider one time and your blood pressure is higher than what we would like to see, there's always an opportunity to start with lifestyle changes. Now, unless, if I take someone's blood pressure and they are in a severe range, which is, and we'll talk more about that later, it may be that I have to start them on medication right away because they're in a range that might be too dangerous, So I see some other people have joined. Thank you for joining today. As you come in, please chat or wave to me in the box so that I know you're here. But thank you for being here today. So again, hey Esther, thank you for being here. I appreciate you. So again, normal, the new normal in terms of blood pressure range is less than 120 and less than 80. Again, very different from what we were using before, which was 140 over 90. Those numbers are now about almost 4 to 5 years old, since we've been using 120 over 80 as our cutoff and no longer using 140 over 90. Okay, so that's very, very important, y'all. Sometimes, so like I was saying, sometimes when people come in and their blood pressure is elevated, mildly elevated, we'll absolutely start with lifestyle changes. And what are some of those lifestyle changes that we'll start with? So if I have a patient who normally comes to see me every 6 months to a year, and let's say that her blood pressure is usually in the range of 110s to 70s, and suddenly she comes in, oh, hey, Dean, thank you so much for being here. Hey, Sean, thank you for joining. Connie, thank you so much for joining today. And Connie said, is that for all races? Sorry if that's a stupid question. No, that's not a stupid question at all. Yes, the numbers that are part of the guidelines are for all races. Hey, Jackie, thank you for being here, sis. The guidelines that are developed are for all races. Okay, Connie, so they don't have different blood pressure measurements by race, but I think I get what your question is asking, because in the United States, absolutely, high blood pressure does disproportionately affect, hey, Number, thank you so much for being here. High blood pressure does disproportionately affect people of color, and there are a range of reasons for that, and we'll talk a little about that later. But no, the numbers, the new guidelines are for everyone across the board. Now, I will also say this. So the 140 over 90 is no longer the target in the U.S., but in Europe, they mostly still use 140 over 90. Now, what's the big difference between us and Europe? We in the U.S. have an obesity epidemic. And one of the things that we'll talk about later is that being overweight, even by 10 to 20 pounds, makes a big difference when it comes to high blood pressure. And so I think that's one of the things that contributes to the scientists and doctors in Europe having slightly different guidelines. Okay, so again, the new normal for US is 120 over 80, and that's been the new normal for about 4 to 5 years now. It's no longer 140 over 90. And so why is that important? So sometimes I'll have a patient come in and, she's there just for her routine GYN visit. Oh, sorry, y'all. That's my golden doodle, my puppy. And, like I said, one of the first things we do in any clinical setting is we take blood pressure for the person before they are examined. So let's say I have a patient come in and she feels great. We talked about high blood pressure being a silent killer. She feels great, and but her blood pressure, when we take it, it's 190 over 111. This is a real example, y'all, because I had a patient with that blood pressure probably about 3 weeks ago. Yes, yes, most agrees with me. Thank you, Connie. So yes, about 3 weeks ago, I had a patient come in. She was just there for her routine annual GYN exam, and her blood pressure was 192 over 111. And so it's important to know, guys, even though we are OB-GYNs and we take care of most, really? Say hi to everyone. Okay. So even though we're OB-GYNs and we take care of all things women's health, a lot of times we're primary care providers as well. We do a lot of primary care. And so I can't look over that high blood pressure and jump right into a pelvic exam. We have to have a conversation about what's going on, what other stressors might be happening in her life, and other things. And so it was interesting, and I use just as an example. In her situation, she was a woman who had multiple stressors going on, had a partner who was sick who she was caring for. She had just moved down from New York. She was also taking care of an elderly mom who was sick. And so the blood pressure of 192 over 111, she was just kind of going about her way. And importantly, she was taking a medicine that she had been prescribed maybe 4 years ago that different providers had continued to refill. And so she had not yet had a chance to update her medicine. So her medicine, and we were talking, and, make sure you have a doctor with whom you can have real talk. So the real talk was, she had maybe taken the medicine 2 days before that. Y'all know how we do. I have family members that do the same. I'm not going to call any names, but I have family members that'll decide, well, I'm going to take this pill on Tuesday and Friday, or I'm going to break this pill in half and take it on this day, outside of how it was prescribed. But I think that's what she was doing to try to make her medicine stretch, because she was having a hard time getting in to see her primary care provider. And she was doing the best she could do because she had all these other things going on in her life. So the good part to that story was that, after she was in the office for about 10 minutes or so and was able to get a little bit more relaxed, I double checked her blood pressure. It was better. So I proceeded with the exam. There are some blood pressure cutoffs, y'all, where you might have your GYN say, no, I can't do a pelvic exam right now because I don't want to put a speculum into your vagina and that cause a sudden increase in your blood pressure, because a pelvic exam, a speculum exam, is also considered something that can be stressful and that can cause your blood pressure to shoot up. And so if someone has a blood pressure that is, again, this is considered hypertensive crisis range, higher than 180 systolic and higher than 120 diastolic, usually that's someone that will be like, no, ma'am, we got to send you to the emergency room. Unless they are able to, unless you double check it after they've had a chance to just relax and, take some deep breaths for a few minutes. If it goes down, that's great. If they have their medicine with them and maybe they didn't take their medicine that morning, great. Give them a chance to take their medicine. Maybe it'll go down. But there are some blood pressures that will cause us to escort you directly from our offices over to either the emergency room or, for me to find some other way outside of the inpatient hospital setting, for me to find some way to get your blood pressure to come down so that we can continue with that visit. So that's very important to know what those numbers are. What are some of the things we can do to lower our blood pressure? So a lot of what happens with blood pressure is absolutely tied to genetics. It's important to know what's going on in terms of our family history. So, if I'm having my annual visit, it's important that my doctor know that, high blood pressure runs in my family, as does diabetes. Diabetes can contribute to high blood pressure because diabetes, which is, the body's ability to process sugar changes, and sugar, just like it's sticky when we eat it, that same stickiness happens on the blood vessels. And so that stickiness is there. The blood vessels are narrower than what they would be. And that also sends the blood pressure up. And so, when we talk about high blood pressure and heart disease and the fact that high blood pressure can have a negative impact on our end organs, absolutely diabetes plays into that as well. So we can't change genetics, but there are some things that we can do to try to minimize our risk. One thing that is very important for us to do. Hey, Jonathan, thank you so much for being here. One thing that's important for us to do, especially for women, we talk about heart disease being the leading killer among women, among men as well. But especially as we get older, 20, 25 above, and as weight starts to creep on, I'm guilty of it myself. One of the biggest things we can do to decrease our risk is to try to reach and maintain a healthy weight. For women, losing even 10 pounds really helps us, 20 pounds even better. So it's important when you go to see your provider, figure out what your ideal weight is and then work toward that goal in ways that will not be too difficult and also be sustainable over the long term. Definitely want you to work toward that goal. Low salt diet. That's another thing that you can try to do to try to manage your blood pressure and try to get it to be lower over time. Now, with these things, I'm talking about things that are can be tried even before you go on high blood pressure medicine. If you're on high blood pressure medicine, I'm not at all saying to stop your blood pressure medicine. Make sure that your blood pressure is optimized. And one of the things you might have to do is be on high blood pressure medicine. Okay. Low salt diet is good. Physical activity. When our First Lady, Michelle Obama, was talking about, being active and movement as part of an overall healthy process, that is absolutely something that helps our high blood pressure overall. And so physical activity, 20 to 30 minutes of moderate exercise, at least 3 days a week. Great if you can get in 6 or 7 days a week. Every day is great because then you establish a routine. And when I say moderate exercise, just walking. Walking is really great exercise. Bicycling is great exercise. I used to take a boxing class. I haven't been able to take that class during COVID, but boxing is outstanding exercise as well as a stress reducer. So be sure to explore and consider boxing where you are as a way to get in some exercise and to reduce stress as well. So those are the things I wanted to talk with you guys about. High blood pressure. It's so important, y'all, because it truly is a silent killer. And just like I described that patient to you, the good news follow-up story for that patient is, when I saw her and the blood pressure was 190s over 111, the first thing I did was change her blood pressure medicine, because clearly the medicine that she had been taking for the last 4 to 5 years and had not changed, primarily because she was not able to get in to see her primary care doctor, it was no longer working. And so that's something important to talk with your caregivers about as well. One thing that has become increasingly important, especially when you think about the fact that we're going through this pandemic, is that your blood pressure be checked in between those doctor visits. And so a lot of people these days were able to prescribe a blood pressure cuff that they can have at home so that they can take their blood pressure at home. That's important so that you can call your provider and let them know. Especially if you're taking medication and your blood pressure is still giving you high readings, it's important so that the medication can be adjusted. With my patient, I took her off that medicine, put her on a different medicine. And when I saw her 2 weeks later, so I just saw her again last week, her blood pressure was much better. Not 120 over 80, but certainly moving closer toward where it should be. When people have really severe range high blood pressure, like the 190s to 200s over, 100s to 110s, getting under 120 over 80 is not necessarily going to work with them. But even if you get them to like 150 over 90, they are still going to have better perfusion in terms of their blood pressure getting to where it needs to go in their bodies. And so the goal is different for everyone depending on what their baseline blood pressure is outside of medication, what their blood pressure is with medication, and then how far you can get it to go. Sometimes there are persons who need more than one medication. Hey, sis. Hey, Patricia. Thank you so much for joining today. Sometimes there are people who need more than one medication. We always start with one. And a lot of times we will add a second one if it looks like the blood pressure is not quite optimally managed. And so, again, I just encourage these, just want to share these facts with you guys today so that you can have a better sense of what's going on with high blood pressure, why it's so common, what it means when your blood pressure is up, and how much harder your heart is working when your blood pressure is up. And ideally, we don't want our hearts to have to overwork, because that compromises the organs in our bodies that we talked about. It can lead to heart failure, heart attack, stroke, kidney failure, and all those things that we would ideally like to delay or prevent so that we can live longer and healthier lives. So again, the new normal for the U.S. for the last 4 to 5 years in terms of our goals for normal blood pressure is less than 120 and less than 80. Okay, it's no longer 140 over 90. So I definitely wanted you guys to know that. One thing that also you can do when you do see your health professional, if you don't have a blood pressure cuff at home, stop in one of the stores near you. Oh, Patricia says, sadly, I've been on high blood pressure medication for a decade now. Yes, so there are definitely some people now, Patricia, you guys can't see, it's just her face that you see here, but, I spoke a little bit about the genetic component. So Patricia is one of, former military, one of the people who is most physically fit if you were to see someone. So again, the genetics can sometimes be very strong, and they can overpower even the lifestyle things that we do. So it's important to know and understand the contribution of genetics as it relates to high blood pressure. And Gerald said, "What's up, Doc? Keep up the good work." Thank you so much, Gerald. I appreciate that. So I want you guys to definitely check and follow your blood pressure in between your clinical visits. If you don't have a cuff at home, ask your doctor actually when you go to see them. Hey, I know that I've been on this medicine for a while. I'd like to have a blood pressure cuff at home so that I can check in between visits. These days, especially during the pandemic, we're doing a lot of prescriptions for blood pressure cuffs so that patients can have some ability to check on their own while they're at home. Cheryl says mine just got increased to a combination of 3 different meds. Yes, Cheryl, sometimes we will have patients that, we really have to tweak the different medications, see how they interact together, see how the person responds to those blood pressure medicines, and, just keep tweaking until we get the right combination to make sure that your blood pressure is optimally where it needs to be so that you can be as healthy as you can be. But thanks for sharing that. Hopefully that third one, the combination of the 3 together, is going to make a difference, hopefully. So what are some other things I want you guys to keep in mind when you see your provider or in between visits? Think about how often you want to check your blood pressure. If you only see your provider once every 6 months or once a year, definitely you need to check your blood pressure in between, especially if you're taking blood pressure medication. Okay, I would say about once a week is great. Once a month is great also. Cheryl said, I hope so. It will, day one, it will. And if not, you let your provider know. And there are so many high blood pressure medicines on the market that we always have some different options when it comes to tweaking and making sure that you have the right combination, the right fit. So take your blood pressure at least, if not weekly, at least once a month in between visits, especially if you only see your provider every 6 months to a year. Keep a log of your blood pressure. Some machines these days will keep it electronically. There are all these different apps on the phones. You can try to use one of those, or you can have an old school pad and just write it down, just some way that you can share the information with your provider. Take all medications as prescribed. I was joking with you guys earlier, but it's reality for a lot of people, where people take medications not as they're prescribed, either because they're trying to stretch them or because they don't feel the symptoms of high blood pressure. But remember, high blood pressure, hypertension, a lot of times does not have any symptoms associated with it. So be careful with that. Don't split a pill in half unless your provider told you to do it that way. Or if you feel that you have symptoms of low blood pressure, that's another reason to call your provider and say, hey, I'm feeling some dizziness, I'm feeling some other stuff, maybe my blood pressure is too low. But also take your blood pressure when you feel that way so that you can know what your blood pressure is at that time. Eat less salt in your diet. Definitely manage stress. You guys will sometimes hear me talk about self-care. Decreasing stress is absolutely something that will help decrease your blood pressure. So absolutely, when you are checking your blood pressure, if something has been going on, I want you to check all the different stressors that are going on in your world and try to remove those. And you will see over time that has helped your blood pressure. Hey, Michelle, thank you so much for being here, sis. It's good to see you. So that's something to keep in mind. If you can, do some mild to moderate exercise most days of the week. The last few years, and also dietary changes, reducing salt and stuff. The last few years, you guys have probably been seeing more people becoming vegan. That's all because they're trying to adjust the things in their diet and give their bodies more heart healthy foods. And so that's absolutely something that has been shown over time to help decrease high blood pressure. And those are the main things that I wanted to talk with you guys about today. High blood pressure, what it is, what are the newest numbers for normal range, and what are some things we can do to lower our blood pressure. So again, don't forget, the most important thing is that the new numbers for high blood pressure, they're no longer 140/90. They are 120/80 in terms of the goal that you want to remain under to have what's considered a normal blood pressure. Even having a systolic of 120/120 or to 129 and less than 80 or even above 80 is no longer considered normal. That's considered elevated. So just keep that in mind, y'all. These numbers change as needed based on what we're seeing in medicine and science. And, having a lower target is really trying to help us prevent some of the diseases that are attached to having elevated blood pressure over the long run. Okay. So I certainly appreciate you guys for being here today. Does anyone have any questions? If you have any questions, please put them in the chat and we can cover them before we finish today. And so let me give you a preview for next week. So I'm excited for next week. I'm going to be interviewing a different type of physician, a urologist, and she works specifically with women. I've had many of you inbox me with questions regarding bladder health for women as it relates to overall pelvic health and overall women's health. Excuse me, I'm sorry. So next week I'm excited because I'm going to do a live interview with a urologist. She's also a surgeon, and she'll be able to answer a lot of your questions. Sorry, y'all. It's pollen season here in Atlanta, so some of that pollen is just stuck in my throat. Sorry about that. Jackie says this was very helpful for me. Thank you so much, sis. I appreciate that. Well, I am going to sign off so I can go get some water. Thank you, Sean. Oh, thank you, sis. Very helpful information. Thank you. So I am Dr. Madeline, your board certified OBGYN. Oh, international speaker, published author, and lover of all things related to women's health. Hey, Sharon, thank you so much for joining. Oh, yes, sis. I think you'll enjoy next week. So definitely join next week. I'm going to create a flyer and put it on the this page so that you guys can see the details. Thank you, Esther. I appreciate you being here. You're welcome. You're welcome, everyone. So please, this week, my ask of you is that you please go to youtube.com, search for Dr. Madeline, MD, and please subscribe to my YouTube channel. I'm going to have the live interview there as well as here. I'm going to try to do a dual broadcast and make sure that you guys can see it, whatever platform you're on. So, thank you again for being here today. I appreciate all of you. And please, please, please remember to keep in mind your blood pressure. If you haven't checked it in a while, go and get it checked. And remember, the new numbers are 120/80. Okay? I love you guys. I'll see you next Sunday. Bye-bye.